Tonight, a case of the haves and have-nots, those who desperately need it and those who have some to spare.
Yeah, we're talking about Remdesivir, the only known drug so far to help patients with COVID-19, help them recover and survive. States that need it, California, Florida, and others that are experiencing big spikes. CBS 2 investigator Megan Hickey joins us live now from Northwestern Memorial Hospital, one place that wants to help. Megan?
Right, Brad and Erica, Northwestern is one of several local hospitals interested in donating some of their remdesivir to hospitals in states with soaring infections, but they're learning that that process is anything but simple. Right now, it's the only drug authorized by the Food and Drug Administration to treat COVID-19. But when it comes to remdesivir supplies, some hospitals in states with a surging number of cases are
completely out. There are hospitals, including large healthcare systems in Florida, Texas, and Arizona that have been reported to be out of the medication, which means patients in their hospitals don't have access to it.
Dr. Michael Eisen is an infectious disease specialist at Northwestern Memorial, and he's been left frustrated by a lack of transparency when it comes to how the drug is distributed. And because it's federally controlled, he can't just ship his surplus medicine to other states in need.
We would all love to be able to help, especially since thankfully cases are relatively low here in Illinois.
About 1,000 miles away at the University of Massachusetts Medical School,
but it seemed to be quite random.
Dr. Nicole Theodoropoulos says right now they have medicine to spare as well.
It's slightly frustrating when you know that there is drug in some places and we can't just distribute it to those that need it.
A Health and Human Services, or HHS, spokesperson told the CBS 2 investigators they suggest hospitals first contact their state health department to reallocate the product. Then the state would have to work with HHS to transfer it across state lines. The 3,248 cases distributed nationwide between July 10th and July 19th will focus on those states with recent spikes. But both Dr. Eisen and Dr. Theodoropoulos worry that the current process takes too much time.
That's great when the drug arrives.
And it needs to be streamlined.
But there are hospitals today where patients with COVID-19 are being admitted that aren't being given access to this drug solely because they made the decision to go to one hospital that's out.
Now, we reached out to more than a dozen local health systems to ask about their remdesivir supplies. The ones we heard back from did say they had an adequate supply. In fact, Amita Health was able to ship 7 cases of remdesivir to hospitals in Florida, but they were only able to do that because those hospitals were part of the same health network here in Illinois. Brad?
Megan, did you hear from any hospitals that are completely out of the drug?
Brad, we reached out to several hospitals in those hot spots. We heard from one in Texas. They said they were out of the drug for 2 weeks. We heard from another in Florida, said they ran out on Tuesday. Currently, we're in the process of procuring some more, so certainly a very active, real issue in some of those hotspot states right now. Live in Streeterville, Megan Hickey, CBS 2 investigators.
And Megan, one more question for you. If this thing boomerangs on us and all of a sudden we see a drastic spike in cases, are hospitals thoughtful, like they ship it all off and then, hey, we might need it back? Is that part of the conversation as well?
So when making any sort of donations, they want to obviously keep that in mind, that they need to keep some in case there were surges here, but they're also looking to see if there would be future shipments where Illinois would receive more cases in the future. So they would be relying on future shipments of remdesivir to spots like Illinois, Boston, those areas that are doing okay right now.
Okay. Megan Hickey, thank you.